Breastfeeding is the most beautiful, the most useful and the most important start that you can give your child in terms of health. Now, even mothers with adopted babies or with babies born out of surrogacies can and are most importantly willing to breastfeed their babies, of course through some special means. Today, I, Dr. Sudeshna Ray, would give you some tips on breastfeeding so that the journey becomes easier and smoother.
Tip number 1. Motivate yourself for breastfeeding your baby while you're pregnant. Start from the 8th month onwards. Understand the importance of breastfeeding and tell yourself several times a day that you can do it and you will do it.
Tip number 2. Babies are born with the talent of suckling. So put the baby to the breast in the first hour of the birth. Keep the baby close to your chest. Soon after the baby doctors clean the baby or wrap the baby and give it to you. This creates an instant sort of a bond and recognition for the baby. It also causes the milk reflex to start. Even if the baby is not getting anything from the nipple, it's better to put the baby to the nipple and start the process of suckling so that a signal goes to the brain that this is the time to start the breast milk production. You can do it after a normal delivery, you can do it after a cesarean birth, even after the birth of surrogate babies. Tip number 3. While you're in the hospital, try to keep the baby in your room close to yourself. Of course, if the doctors permit you. Now this is called rooming in. Whenever the baby is hungry, first put the baby to your nipple and let the baby suckle. The more the baby suckles, the more signals go to the brain and the more milk flows into the breasts. The first milk or the colostrum is a very, very rich source of immunity to the baby. Point number 4. Breast milk will take 48 to 72 hours for it to be fully flowing. Give your body that time. Do not hurry, don't panic. Tip number 5. Learn the ways to make your baby suckle the right way while you're in the hospital. You can take the help of doctors, you can take the help of nurses. Some of the hospitals even have lactation consultants who can come and guide you the right way. Most of the breast problems like cracked nipples or painful breasts happen because of an improper suckling. The baby has to take not only the nipple but nipple and a little bit part of the black part around the nipple called the areola for a correct suckling. Number 6. The more the baby suckles, the more milk comes down into the breasts. Now, in the initial few weeks, the baby is too small and the appetite of the baby is also too small, so the baby will also take very small amounts of milk. What you can do is discard the rest of the milk by manual pumping or by the use of breast pumps. If you do it immediately after feeding, the milk is already in the center and it will be easier for you to pump it out. Tip number 7. At home, make a breastfeeding corner. Keep a corner dedicated to the breastfeeding. There you should have your water bottles, a clean water and a bowl and a cotton to clean the nipples before feeding. You will feel very thirsty while feeding, so have enough water there. You can also keep a soothing music to keep yourself relaxed while feeding. Tip number 8. For the first few weeks, neither the baby nor you are used to each other. So the feeding demands can be erratic and completely unpatterned. Sometimes the baby might sleep for 4 hours after a feed and sometimes the baby can wake up in half an hour after the feed. This happens, don't get confused. Over a period of time, this will settle down in a proper pattern. Tip number 9. Your baby is your best pump. No artificial pump can be as good. So don't try to replace suckling with an artificial pump to empty your breast. Of course, if you have a cracked nipple or a very, very painful nipple, you can give the nipple a little rest You can apply your own milk, or you can apply some specific ointments meant for it, and you can relieve the nipple from suckling for about 24 hours before you're good to go again. Tip number 10. Do not wait for your baby to get very hungry. As soon as the baby is showing some signs of hunger, like it's moving, or it's making some sounds, or it's turning, or it's grimacing, making faces, try and get yourself ready for the feed. Make yourself relaxed and comfortable first. If you are anxious, the baby senses that anxiety directly from your chest and becomes restless while feeding. Enjoy the time of feeding as much as you can. Remember, the struggle is maximum in the first few weeks. After about 6 to 8 weeks, the whole process becomes a cakewalk. So grit your teeth and storm through the initial few weeks so that you can sail through the entire journey for at least for the rest 1 year. And you will have enough milk if you have enough rest, if you have good amount of water, if you have good nutritious food, and if you are relaxed.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.